Good afternoon, everyone. I am here to present the topic of optical coherence tomography imaging of the proximal lacrimal system. I have no financial relationships to declare. The human lacrimal drainage system comprises an upper and lower punctum situated towards the medial end of eyelids. The lower punctum connects to 2 mm section of descending vertical canaliculus before turning medially for 8 mm and join the upper canaliculus and then into lacrimal sac. Our aim was to study whether OCT may be used to image the punctum and proximal canaliculus. OCT image of lower punctum were captured with a Topcon 3D OCT machine. Anterior segment module was used. Single line anterior high resolution scanning was used. 52 puncta of 28 subjects were scanned. The puncta was recognizable on OCT image in all cases. The medial lower eyelid was gently everted to expose the punctum to the OCT scanner with maximum care taken not to distort the anatomy. Canalicular length ranged from 462 to 1242 micron with mean length of 864 micron. Peak width of canaliculum ranged from 126 to 401 micron. Mean width was 234 micron. Punctal anatomy is clinically relevant in the management of epiphora because punctal stenosis is one of its major causes. It is also relevant to design of punctal plugs and assessment of their function. However, there are currently no routinely used imaging modalities or objective quantitative assessment system for the punctal rectimal system. There is currently no other practical way to accurately image the punctal and proximal canalicular morphology in vivo. OCT is a practical and readily available tool in most eye clinics. Its resolution is ideally suited to image of the punctum and proximal canaliculus. Punctal OCT relies on scanners' infrared beam traveling directly through the canaliculus rather than through the surrounding skin. Alignment of punctum and canaliculus with the axis of the scanner's infrared beam is essential. As the wall of the canaliculus often appear to come together in a different shape, and it is difficult to decide at which point to measure the diameter of the canaliculus. However, even the longest canaliculus that we imaged was still much shorter than 2 mm. This suggests that during the resting period, maximum part of the proximal canalicular system may remain in collapse state and it was not being picked up by SDOCT. Probing with syringe may be similarly unreliable since it may cause dilation of the punctum, thus not giving an accurate representation of patient's normal anatomy. There are no routinely used imaging modalities for proximal lacrimal system. Development of an objective system for imaging the punctum is warranted. So we can conclude that OCT may be used to create a high-resolution image of lacrimal punctum and canaliculus. Further work is required to establish its clinical applicability on a wider scale. These are the references.